Oscar 481, maintain 170 knots, Finco.
170 Finco, Oscar 41.
In the aviation industry, you can't learn by failing, and when you do fail, it can be catastrophic. When they started looking into some of the problems associated with a number of high-profile crashes, what they started discovering was they had issues with poor communication, lack of standardization, and a lack of safety in the cockpit, a hierarchical, unsafe dynamic that led to, for example, a co-pilot feeling not safe speaking up to a pilot when they recognized a safety issue in the flight or in the cockpit or pre-flight. In a safety culture, you need leadership that's committed to transparency, trust, open communication, and a continuous learning environment. They need an accountability model that balances individual accountability and systems accountability. We started thinking, like pilots and surgeons, our child welfare professionals are making these high-risk, high-consequence decisions all day long, and might they also benefit from these same strategies and tactics?
We hear safety culture and we think of physical safety first, which is crucial, which is important. You would never neglect that. What is psychological safety if not also for the presence of physical safety? But psychological safety is about feeling respected and safe with your colleagues, feeling respected and safe with your supervisor to share your experiences, your concerns, your thoughts. It's speaking up candidly, speaking up professionally, and also, and maybe most importantly, it's safety to feel like you can disclose when you make a mistake. Another really specific place in our system where safety culture is really at the heart is our confidential safety reporting system. Those reports go straight to our executive leadership. When you go out and you see a rural area and you see a four-wheel drive vehicle and a satellite phone, those staff advocated for their conditions.
Some of the roads we see, some of them are just straight up as a mule's face, rough and rutted out, muddy. And I've marred up in some very short driveways. I've had to remove a child one time and then have to have part of the family hook a tractor to the car and pull it out of the mud in their driveway. And most folks get into this job to try to keep children safe, but they don't think necessarily about their own personal safety. So we just like every opportunity to get home at night.
They reported to the confidential reporting system and said, we have, there are some concerns. There are some concerns out here we think you should see, and our leadership responded to that.
The staff that is well-trained and feels secure and feels supported, our experience is those staff are able to do a more comprehensive, thorough job and be responsive to the families and the children.
You know, I think safety culture it's not just a concept, it is what we are now. The first drug team that we started in a partnership with the University of Tennessee Medical Center, their neonatal unit had seen a very big increase in children born addicted to drugs. So we worked with Dr. Mark Gaylord, and we formed a partnership with the neonatal unit's medical staff and social work staff. Somebody had to think we needed to do this a different way, and somebody felt empowered to start a drug team. They know they're accountable, they have no problem with accountability, but yet they feel safe to go out and to look for new resources and to be empowered to take risks that they didn't feel like they could take before.
What we learned from Tennessee was that they had started this new concept of looking at their death review process, how they interacted with their staff, and understanding how their system worked.
We certainly had a culture of fear and distrust and really just disenfranchisement throughout this entire organization and frankly throughout the entire system of child welfare in Arizona.
It doesn't help when you blame and judge people for the decisions that they made. It doesn't get you anywhere. But trying to understand why people make the decisions, that's what's important.
We make it possible for them to be successful. We give them a feeling of safety and not a blame culture around here, and they go to work. And they've been doing it a whole lot better than they used to.
I think if our staff feel safe coming to work every day, if they feel safe in the decisions that they can make, it'll be better outcomes for families, for children. And I think that's the ultimate. That's what everybody wants in child welfare, is better outcomes for children and families.
We've confronted the processes. We've given people the culture of safety here to operate within, and we're seeing good results across the board. We're seeing less kids coming into care, more kids leaving care, and no uptick in recurrent maltreatment of kids.
You must keep hope alive. Whether it's your staff, whether it's the families, whether it's the children. Because without that, we can't keep developing and growing and thriving. So hope undergirds everything we do as a child welfare agency.